Now go.
All right. Well, we're improvising tonight because our Collaborate group doing our case study. Hi, Dr. Olson. We're having some technical issues because Blackboard is down or something. We're not sure, but we all assembled here and we wanted to get this done, so we decided to improvise. We have a computer set up over here with Kristen and Brianna online.
Okay.
And then we have our group here. We're all at the library, and we'll just introduce everybody. It's Stephen here. And
I'm Alex Stewart.
Julee, Schmeltzer.
Justin Wickler.
I'm Holly Smith.
And who's on the computer?
Brianna White.
And
Kristen Turner.
awesome. Okay, so I'm going to set the computer up, or the camera up over there so we can constantly record. Is it recording?
Yeah.
Yes, okay. Technical issues. All right. Okay, it's recording, right?
Okay.
I can splice it.
Okay. Are you
Okay.
saying something right now?
Yeah, I'm saying something right now. Okay, in this first part, second part of the video, since we've introduced ourselves already, we're going to talk about question 1 and what our individual stances on Mr. Mann or on Miss Bay as far as who should be procuring this organ. The first question says, the information you have gathered about liver allocation and transplantation provides you with a picture, though somewhat limited, of Mr. Mann's and Miss Bay's circumstances. Which patient would you choose, and what is your rationale? Holly, do you mind starting us off with that?
Sure. Okay, so it's a hard decision for sure, deciding on who is going to get a liver. And there are guidelines in place. And as I considered who I thought should receive the liver, I considered age and also how long the liver would last after transplant. And with Mr. Mann, he has cirrhosis because of alcoholism. And with Miss Bay, she has hepatitis C, and the medication has not gotten rid of the hepatitis C, so she still has that in her system, in her body, she would have a better chance of the liver lasting if the hepatitis C was gone, but it's not. And for Mr. Mann, he is 50 years old, and that's kind of on the older end for a transplant. If you look at, I looked up the different reasons for giving a liver. I'm trying to get there. Where is it? Sorry. So if you base it on, there's 4 things that it can be based on. The sickest patient, first come, first serve, social worth principle, and the best success rate. And we have a large need for livers in the US, and we don't have enough to go around. So you want it to be worth it. You want them to last once they've received a liver. And in my opinion, I would say that I would want the sickest patient to receive a liver. So just looking through their different scenarios, the social worth principle came up as well, and Miss Bay is a mom and a wife and has 2 kids. She's part of a close-knit family. Mr. Mann doesn't have much social support. He has been a heavy drinker and has had liver disease related to alcohol. So anyway, I guess my choice would be Miss Bay because she's younger and she has more support from her family.
That's good. I think it's great. All right, Brianna, I think you're up. And speak loudly if you can.
We can't hear you.
Uh-oh.
I turned my mic off. There was some people coming in and out of the room, so I didn't want it to be too loud. So while reading the case study, I will definitely say I immediately made assumptions about who I would choose just based on the limited information I had about these patients. I immediately went to Miss Bay. I was thinking she has family, she has children, she's younger, like she's more deserving in my mind. But then when I was reading, some more information about her Hep C, like the longevity and the success rate really does have to take into account because, like Holly said, livers are not, in excess, and we have to be really particular about who's receiving them. And so I did actually read multiple articles about alcoholism and how it affects longevity. And if one of the articles I'm going to be referencing is called Liver Transplantation and Alcoholic Liver Disease History, Controversies, and Considerations. And the reason that I chose that is because when I was reading it, it talks a lot about how, alcoholism and abstinence can definitely be held for... You all are laughing at me. What am I doing wrong?
No, you're doing great. You're doing great.
Okay, good. Okay. So when I was reading it, a lot of it was saying, abstinence, the 6 month rule is preferred, and that they can have a really good likelihood of recovery and success, but they really stress the importance on staying sober afterwards. And in this one part, it was talking about the following factors are an association of a reoccurrence of alcoholism, and it talks about poor social support, multiple treatment failures, family history of alcoholism, medical noncompliance, continued use despite knowing its consequences, and so forth. But then it continues to go on that, hold on, let me get there, that the, sorry, I lost it, I scrolled too fast, sorry, that those who began drinking moderate to heavy within up to 9 years after started to show liver transplant rejection and developed alcoholic hepatitis, and then that is now they're going to need a new liver again. And so when he is talking about how he's not sure if he's going to stay sober and that he's only doing it to get the liver, makes me really concerned that he's not going to stay sober, and that at that point the liver is going to do no better to him than it would to her, and that she has social support and overall health and age on her side to make it as successful as possible. So I kind of chose her as my final because of that supporting evidence.
Cool.
Anyway, that's not ended, but there it is.
No, that's perfect. No. Okay.
All right.
Okay, Kristen, how about you tell us about yours? Your opinion.
So overall, I chose Miss Bay for getting a liver transplant. I mean, yes, she has been on her viral medication, but it hasn't been working. But according to this article that I found called Hepatitis C and Liver Transplant by these names I can't say because they're too hard, even though where was I? Sorry, I'm trying to find the section. Even though the viral medication for the patient with cirrhosis is not highly successful, but more importantly, having even just a little bit of the viral medication can address at least a little bit of the liver transplant. And it says that, what was it? That patients with HCV, even though it does translate into the next new liver, they can still live to, I think it's from this article, it's like a 22.9 months, compared to the liver transplant for alcohol cirrhosis. It's a lot less than that just because of the fact that they can relapse. And also on the alcohol cirrhosis, on the article for liver transplant and alcoholic liver disease history, controversies and considerations, it's also said that because of the alcohol cirrhosis, the person is more likely to be depressed, and more likely to relapse. And I'm trying to see where I was looking at. And that there's more of a 55% chance that someone with alcoholism can relapse, even though they did get the liver transplant. And considering that Mr. Mann sounds like he doesn't have any social support and lives alone, is divorced. And he does have 2 sons, but they're not on good terms with him. So I guess that's where my main support is for Miss Bay, is because she's able to have all that support, pretty much what Brianna said already. And just having that support is huge for someone, and just to be there for someone. I mean, they're in such a chronic state, you just want to be there for that person. If there's no one to be there with you, then you're more likely to relapse. And yeah, I think I'm just overstating, but you get the point. Yeah. Cool. So Miss Bay all the way.
Miss Bay. Okay, so far we've got 3 for 3 on Miss Bay. And now we got Justin.
Yeah. So
thanks, Kristen.
So originally I was leaning towards the side of Miss Bay, as she has a family support system, she has children, and I was, like Brianna, using my own judgment for that. But as I got into reading about the articles, I was reading a lot about the hepatitis C virus infection itself inside the transplant recipient. And the article that I got it from is Management of Hepatitis C Virus Infection in Liver Transplant Recipients, written by Satish Nair. He's an MD out of Methodist University Hospital and University of Tennessee Medical Center. And what I was seeing was that patients who have hepatitis C really need to get rid of the whole virus before they can get their liver transplant. So seeing that Mrs. Bay didn't have the whole viral infection eliminated yet, it was very difficult to make an ethical decision for her to get the liver, knowing that the next liver was likely going to be infected with the hepatitis C. So I decided to go with Mr. Mann, even though he's older and there is the risk of him relapsing. I decided that he was still sick enough. Even though he's not the first on the list like Mrs. Mann is, or Miss Bay is. So Miss Bay is higher up on the transplant list, but because Mr. Mann is more likely to recover and he is partaking in the 6-month abstinence of alcohol withdrawal, he is my choice for who I would choose. Social worth, I would have went with Miss Bay due to her children and support system that she has, but I decided that the most ethical choice would be Mr. Mann, due to the reason being that the antiviral treatment that she was getting was not yet effective. Trying to think. I read something in the article that I read that the most reliable way to prevent post-transplantation HCV infection is to cure the infection before the transplantation, which I already stated, as well as interferon-based antiviral therapy not tolerated in the immediate post-transplantation period. So she wouldn't be able to continue the treatment if she were given the new liver. So I think that's my take on it. So I'm going with Mr. Mann as my patient I would choose for this liver transplant.
Cool. Okay. Thanks, Justin.
Yep.
All right, Julie.
All right, well, my vote's for Miss Bay, because she's the sickest patient and she's first on the list. And my take on social worth was really, you can't take into account their social work. That's how I interpreted that stuff. So even though Mr. Mann doesn't have a good, social worth, we can't.
Social support. Yeah.
So, well, in this case, yeah, he doesn't play a role in society. He doesn't have that kind of social worth. So my vote's for Miss Bay. And do you want me to say anything about the other stuff now, or wait, are we coming back around?
It's we can actually have like a full debate after this,
Okay.
I guess, and talk just a free flow debate.
Okay.
Yeah, I like that.
Okay.
Okay, Alex. Thanks, Julie.
So, I guess overall, I'm gonna go with Mr. Mann, but I'm kind of on the fence, I guess. I see the points that other people have made about Miss Bay is younger, and she's first on the list, but when I was reading the article, Alcohol Relapse After Liver Transplantation for Alcoholic Cirrhosis, Impact on Liver Graft and Patient Survival, a meta-analysis, it states that the 5-year patient survival after liver transplant for alcoholic cirrhosis is reported to be similar compared to other transplantations for other indications, and that it's better compared to patients who are transplanted for hepatitis C. So in that respect, actually, liver transplant for alcoholic cirrhosis has better survival than, so like Mr. Mann would have a better survival than Miss Bay. And I understand that relapse is a huge consideration, obviously. And I'm interested where Kristen got the 50% number as far as relapse, because, and I'm not saying that probably is from somewhere, because I read it can be from relapse is from 10 to 50% based on this article, and it was for patients that have had liver transplant, the relapse rate's 10 to 50%. But it was also saying that in general, the relapse rate for heavy alcohol use is 5%. For annual incidence of alcohol relapse is 5% for any alcohol use, and 2.5% for heavy alcohol use. And I understand that there's a lot of considerations as far as alcohol relapse, and lifetime drinking problem is an indication that they could have another relapse. But ethically speaking, we can't say if he's gonna relapse or not. And I don't think that should be something that you consider. I mean, basically we're basing he's not going to survive without this liver. And we're basing his life or death on the fact that he might relapse. And that just doesn't feel fair. And I get that it's complicated. And maybe I just want to believe the best in people, but this, based on this, the statistics they say that he has a better chance in 5 years than she does. Kristen wants to say something.
I was like, wait, can I say something? I actually got the percentage wrong. A model of end-stage liver disease and people with alcoholic cirrhosis, the probability of reconsumption was actually 70%, with both factors.
In how many years? post-transplant? Do you know?
It doesn't say.
And
And it also, I forgot to mention this earlier, but it also depends on where they are, like, globally, because
Yeah.
I read
Yeah.
too in another study by James Trotter and Andres Cardenas, liver transplant around the world,
German.
is that, oh wait, are we doing that later?
No,
Wait,
no,
we
you
can
got
talk
it.
about it now.
Talk about it. This is good. This is
Okay.
this is debate, discussion.
I mean, what was it? I mean, the U.S. is the most performed liver transplants than any other country, nearly 7,000 per year, second to China, followed by Brazil. But it was also super interesting is that other countries don't have transplant priority systems in place. And countries like India, where there's no agreed minimal listing criteria,
Plus,
in
people
smaller
don't drink
countries
alcohol.
Ireland, there is only one center, thus the priority system works well. But then in Australia and New Zealand, they're well organized despite the distance between centers. This is mainly due to their long experience in organ transplantation, I guess. And I guess too, what was it? There's also, which is the one? And sorry, 1 second. Although selected patients with alcoholic hepatitis may benefit from liver transplants, most countries surveyed still do not perform transplants for this indication. In the majority, abstinence must be proven by at least 2 negative tests during the 6 months before listing the patient, and evaluation by dedicated psychologist or psychiatrist too, which I also found interesting. But yeah, that's all I got. But
I
Wait.
want to add on to that because in my article it talks about. Sorry, we're talking about percentages, and so I wanted to throw one out there. In my article, it talks that a specific study that they referenced followed liver transplant patients with alcoholic liver disease up to 9 years, and they found that 46% of them did relapse within those 9 years. And it goes into more specific details of like some relapsed immediately after and then maybe reduced over long term, some waited a long time and then relapsed, it goes into more detail, but overall 46% did eventually relapse in this specific study.
And that was 9 years. Sorry to be clear, it was 9 years.
Yeah, it said patients for up to 9 years.
That's
So,
a pretty
over that
extensive
9-year
study.
period, 46% of them
But that's a
did
long
relapse.
time. My point is 9 years after surgery is a lot of life to be lived. Like, we don't know
Right.
if Miss Bay gets the transplant, we don't know that she'll live for 9 more years.
Well, no, she's probably not gonna live. Yeah.
So I think that's a point, and that's the hard thing with these studies about relapse
Let
is.
me talk about mine, and then we'll get into a debate real quick.
Okay,
I'll just give my opinion real quick about what
Sorry.
we're at. That's okay. Then this debate was really good.
yeah, sorry, guys.
No, it's okay. So similar to Alex, I was kind of torn. I was feeling the heartstrings for Mrs. Bay because she deserves it more. She's young. I mean, we listed like the positives and negatives. Mr. Man is older, and he's at the top end of the transplant scale. He has no family to care for him, no support system, which is an extremely important thing. We've all pointed that out. For maintaining abstinence, you need a support system, and that support system, I'm arguing against it for a moment, but that support system includes psychiatrists and psychologists, social workers, dependency specialist, along with transplant team. You got post-LT, pre-LT. There's just a lot involved. Of course, there's a lot involved with her as well. But as with pointing out with those numbers, it's his ability to maintain his abstinence doesn't sound very positive. But it's an ethical question that we can't make an ethical choice on him based on her, what we like her a lot more. She's got kids and she's young, but her survival rate is very big question, very, very big question. So where do we put our marbles? That's the question. What's the most important thing? Who's going to survive? And yes, there are risk factors for him. My article was similar to Brianna. I was also reading the multiple Italians writing about liver transplantation and alcoholic liver disease, the history, the controversies, and the considerations. And there is a lot of data in here about why cirrhosis patients are going to die. But I think in the end, I'm actually for Mr. Man currently, but you know what? I wake up tomorrow and I might be for Miss Bay because I like Miss Bay. But now we can go into the arguments. I mean, it's what would we say? What is for her? What are some reasons why just baseline reasons why she should be chosen?
She's younger.
She's younger.
She has a family.
She has a family
support system.
She's ahead of him on the list.
Yeah.
She's ahead of him on the list. That's a very important one.
I wish we could have the MELD scores. So the MELD score, I have it right here. Where is it? The MELD score takes into account the patient's date of birth, so their age, their bilirubin levels, their serum sodium levels, their INR and serum creatinine, and then also if they're attending dialysis or not.
Okay.
But it doesn't say anything about location.
No, that was a different one. There's another score for that, but that is one of our questions. Who's the sickest patient? I think we all agreed that. Would we say she was the sickest patient?
Yeah.
Okay. And I mean, Hep C. There was a lot of information about. You have to get, as Justin pointed out, you need to get cured of your Hep C before you have the transplant. And what I found in my article is they're working on, and this was 2016, so we got a lot of data that is not in this article, but the medications right now in 2016 were not working to get rid of the Hep C before she got her transplant. So we don't know, that's up in the air. So, okay, we know where everybody stands. We can't talk about proximity as one of the parameters. Best success rate and long-term outcome. This is the utilitarian, consequential perspective. Who has the best success rate?
It depends on, and that depends on what data you look at. Because my study says that Mr. Man has the best success rate, but
Right, not taking into account the fact that he might start drinking, he probably has a better
Definitely
chance of surviving.
he has a better chance.
Transplant.
I think we'd agree he has a better
Yeah.
chance of surviving
If he
the
can stay
transplant as long
sober.
as he can stay sober,
Right.
which is a key point.
It should not reassuring because he said that he didn't he wasn't 100% committed to that idea, so that's where it got me
and
more.
to your
So
point,
it's like I can't trust you.
To your point, Kristen, you talked about the 6-month test. I mean, that's something that I think he would fail.
I thought that was a requirement.
he said he agreed to stay sober for the required amount of
he
time.
wasn't sure about after.
After,
Yeah.
Right, but before he was.
And my
Because it's 6 months after too. Or how is 6 months?
It's not always 6 months.
before.
It's recommended to be 6 months,
Yep.
but it can be tailored to whatever is appropriate.
So that's
And it
BS.
states that in the article that we can read.
That's really shady that they have it tailored to.
Yeah.
I think it depends on how
Which,
if they're gonna
from-
die
from
before the
personal
6
experience,
months.
I've
then-
seen 8 weeks minimum.
Yeah.
So
That's
8
crazy.
weeks, yeah, that's.
But
yeah.
and
Too
my
short.
if I was the nurse in this situation, or if I was the person working with the patient, my thought is if he would agree to go to treatment post transplant, I think that could be based on my thought process, and I don't know how ethical this is, but basically as a stipulation to get the liver, he would have to complete and however long inpatient rehab
But
after.
what's his incentive for doing that rehab after?
It would, yeah, I guess that's true. He could just not.
He's
just
like,
leave.
oh, whatever, I got my
He
liver.
would- yeah, I mean,
That was my thought is, what's the quality of life that each of these patients are gonna experience
That's
with
a good
having a
question.
transplant? Not saying that he doesn't deserve to live 9 more years or however long, but, he doesn't have a support system. He's not in contact with his children. He is not married. It doesn't sound like he has any sort of community support. He doesn't work. And so he sounds very isolated. So it already doesn't sound like he has a very fulfilling life. But then you look at Mrs. Bay and you look at her life and you
To her point,
see
yeah.
she's married, she has children, she's younger.
Right.
So even in my opinion, if at the worst she lives for 3 years versus Mr. Man who might live 10 years, what is going to be the quality of life that these individuals are going to be living during this time frame? Just because it's longer doesn't mean it's better.
no.
And so
But is that our
that's
call
where I
to
stand.
make?
And then, I do want to add, I have another article that I got just because I love articles. And it talks about alcohol relapse in patients who have received help versus have not received help, as in like support groups. And in 3 years, 64% of individuals who didn't receive help relapsed. So
64,
that's
you say?
But part of
pretty high.
But part of his discharge plan and his care should be setting him up with support. Like, anytime we discharge a patient.
But he doesn't want it. That's what it sounds like.
Do you know that though? Like, we don't know that he doesn't want it. We know that he doesn't have it currently, but that doesn't mean he doesn't want it. And I think that that's like the assumption that's made, but we have no idea why he doesn't have a relationship with his 2 sons. Maybe it's from his drinking, but maybe it's not. Like, maybe they are also drug users and they stole from him and he chooses not to have a relationship with him because of who knows why. Like, we don't know that, like, it's him that's the reason there's no relationship there. It could be them. And maybe he, like, we don't know. Yeah, he's not married, but we don't know the story there either. And I've seen plenty of people who can get social support from AA, from other groups, and be super successful and find quality of life and other things later in life. Like, there are options out there, and there's a lot of different resources to provide that support, whether it's AA or there's non-religious treatment programs, and there's inpatient and outpatient, and like, as nurses we should be setting them up with those resources. And
Well, he's gonna need the resources, because, besides the fact that he's gotta stay sober, his body's also been shot in other ways too, because cardiovascularly, I was reading in Moroni that, his cardiovascular system, his cerebral system is shot, and so within 5 years he might be dead from his own damage done to his own body.
Yeah, and in this article it talked about that too, that the mortality rate of
Just systems breaking down.
Right,
Yeah.
of transplant patients, that a high percentage was from non-alcohol related death, that it was from other reasons, whether, cardiovascular or otherwise. But in my opinion, that's a pro versus a con for him. I don't know.
Yeah, no, I like your argument. I'm still on the fence, but I'm for him, but I'm also finding myself arguing points because it makes sense. I know Julie had some really good points from a Pittsburgh study, right?
From the University of Pittsburgh Medical Center. It was kind of interesting because they had their own criteria for transplants that required that people, before they were eligible for the liver transplant process, they had to be free of cancer, alcohol for 6 months, substance abuse, active infections, disabling psychiatric conditions, documented medical noncompliance, lack of adequate social support, and lack of adequate insurance, and then other diseases. Which I thought that was interesting because I thought maybe the requirements within the states were universal. And I guess this isn't saying that they're not allowing those people to have a transplant, they're just requiring they meet those other criteria first, which.
Active infections.
Which Hep C would be.
Yeah. So in this case, neither of our candidates would
Right.
fit their criteria.
Well, he's qualifying because he's going through 6 months of
Well, he's
abstinence.
been
No, but he
absent.
doesn't, he has lack of,
Does-
no social support and no
Oh,
insurance,
that's
so
true, too.
he's kicked to the curb.
Yeah.
Yeah.
And then they also had a line which got
Kicked to the
erased,
curb.
they got erased from the document, but I kind of liked it and I can't find it, that said essentially that whoever was the recipient of the liver would live a life worthy of the gift they've been given. And
Right.
I'm paraphrasing, I can't remember how it said it, but essentially that was
That's how
what it
it
said.
is.
Yeah, it's not on the document.
I mean, that's a judgment.
No, that's a good point
Yeah.
though. That's getting to ethics.
Yeah.
Yeah, well, that's a lot of theirs, I mean, how do you determine that? You
Yeah.
know, what does that mean? Have you lived a life worthy of the
Right.
gift you've been given?
Did anybody watch that the video that was on there? Don't ask that question. There was a video on the homework. Don't ask that question, Stephen. There was a video on the homework that talked about this Jewish community, and I assume it's New York. I don't know, but the Jewish community was coming together and giving up kidneys. I think it was just kidneys, and but they were selectively choosing Jews to give the kidneys to instead of, so this was an ethical question of,
Okay.
they weren't open, they only had, they've given away, I don't remember the number, a lot of kidneys.
Well, these people who,
Alive, or just donating one of their kidneys because they have
right.
2.
that's
Awesome,
yeah.
that's awesome.
That's-
But only 2 out of, thousands.
I feel like that's a different ethical thing though, because if you're still alive and you're giving up part of your body
choose who to give
voluntarily,
it to, right?
you should be able to choose who to give it to.
And I like that I like that
That's what-
argument. Yeah, if I'm gonna, okay, I'm giving up one of my kidneys, I want to choose who I give it to, yeah, I agree. What's going on?
Oh, your microphone's on.
We're chatting to each other. Sorry.
They're chatting to each other.
I guess the ethical thing kind of took it in a different spin, but.
Stay all the way.
Because we're making a
I
choice,
just
what you're
realized I was
talking about
talking
is
and no one could hear
choosing
me 'cause I had my
her
headphones
based on what you feel is right, and I don't disagree with you.
Right, well, but I think
And
the criteria don't allow us to do that, and that's
Neither
the
of them.
point. That's the
Yeah.
point of having all these criteria, is it takes away your personal bias, because the people have to satisfy certain requirements that you didn't determine. Well, definitely you go with your emotional desire to, give it to one person or the other, it's not our call.
yeah, not our call.
And
That's why there's criteria,
That's a good thing.
right?
Yes, perfect, fact.
Yeah. Well, then both, according to that criteria, neither of Mr. Man or Mrs. Bay is going to get
Right.
liver.
Someone else on the transplant
Who's
list
next in
deserves
line?
it. Yeah.
That's right.
Yeah, who's next in line? Okay, so did we feel like we've argued enough at this point?
And I feel like we've gone through a lot of
Yeah.
the social worth and the first
Sustained
come, first-
virological response, yeah.
Lastly, are we able to all choose one or neither? Should we all go through and just pick?
I choose Miss Bay even though I felt like there was really strong arguments, but I feel like I stand by my original decision even with all the evidence presented.
Cool. Kristen?
Kristen?
Miss Bay all the way. Same comments like Brianna. Good arguments, but I still agree with my decision.
Cool.
I go with Mr. Man. Hopefully he won't relapse to the alcohol. I think he has a stronger case.
Oh, me again?
Yeah, we're just doing just in
Miss Bay.
case.
Miss Bay all the way.
Miss Bay all the way is the way to go, okay?
Mr. Man.
Alex says Mr. Man.
And I'm switching to Mr. Man.
Wow.
Based on the
Traitor.
I know, I'm a traitor.
No,
Based on the arguments and just the principle of justice and fairness to everybody involved.
Okay, and I'm sticking with Mr. Mann, even though I feel torn between the two of them. But I feel like I'm with Alex on the fact that he does kind of deserve this chance, in the sense that I think he's going to survive more. But I think they're both pretty challenging. I think that wraps it up. So I hope this works. I've got to pull the video together. So okay, bye-bye. Thank you, everybody.
Thank you.
Thanks, Kristen and
Good
Brianna.
job, you guys.